We are back, and it's time for one of my favorite segments, Live Healthy MD, with my favorite doctor in the world, Dr. Francisco Jacome. What are we talking about today?
So, last time we talked about surgical procedures that will only give you restriction.
Right.
Now I want to talk about the procedures that we consider them weight loss procedures, meaning they will give you the ability to eat very little, but more important, it's going to change the way your body functions, making you lose weight.
Okay.
So, for everybody to understand, if you get one of these procedures, can we guarantee that you will lose weight?
Mm-hmm.
Yes, we can.
Wow.
We can guarantee that you're going to lose weight, and we can guarantee that you're going to lose a lot of weight.
Wow.
And the explanation for this is that the procedure was designed to make you lose weight. It was not a procedure designed to help you just eat very little, but also designed to make you lose weight. Mm-hmm. Along with that, we talk about all the changes, like diabetes cure, blood pressure cure, sleep apnea, as well as cholesterol. Mm-hmm. And one thing that I want to remark is that my passion for bariatric surgery is based on that.
Yeah, and I like what you said, my passion.
And because I love doing it. I mean, I see my patients come with overweight, with diabetes, with hypertension, with cholesterol, sleep apnea, CPAP machine. Their significant other can sleep. Nobody in the house can sleep and then they get a procedure done. And it's a world different. They feel better, they can do better, they can do a lot of things that they weren't able to do before. So the procedures that will make you lose weight, I want to name 3 of them, which are the most popular ones.
Okay.
Number 1, we have something called a sleeve gastrectomy.
Okay.
That is a procedure in which we don't change the path of the food. So normally when we eat, we swallow, it comes into our stomach, and it gets to the first portion of the small intestine.
Okay.
And that first portion of the small intestine is called duodenum. Mm-hmm. So when we do a sleeve gastrectomy, we're not changing the way food goes through you. We only change the size and the shape of the stomach.
Gotcha.
So when we do the procedure, we make a very little stomach. The piece of the stomach that we're cutting, we have to bring it out. And the procedure by itself will help you lose about 60 to 65% of your excess weight.
Oh my God.
So again, it's a weight loss procedure. I will guarantee that you can lose weight. What is the excess weight? Let's define that. So to give an idea, I'm about 5'7". So
you can use me. It's okay. 5 feet.
5 feet. So your ideal body weight, is about 115, 120 pounds. Okay. If your actual weight is 220 pounds, then you're about 100 pounds of excess weight.
Yeah.
Okay.
And I was.
And at that point, if you get a procedure like a sleeve gastrectomy, the surgery by itself will help you get rid between 60 and 65% of that weight.
Wow.
So again, it's a weight loss procedure. The other procedure that I want to talk about is called the gastric bypass.
Which I've heard a lot about.
Yeah. And some people call it the Roux-en-Y. Okay. So this procedure is a procedure in which we change the path of the food, meaning the food doesn't go anymore from your mouth to your stomach to the duodenum. It actually bypasses the stomach.
Oh, that's why it's called.
That's why we call it gastric bypass.
Get out.
So we cut the stomach, we make a little stomach about the size of an egg.
Right.
And the food goes into that stomach, but immediately out of that stomach gets into the small intestine.
Oh, okay.
And that's why it's called gastric bypass.
Cool.
Powerful surgery. It gives you diabetes, blood pressure, sleep apnea, and so on cure. But it will help you lose between 70 to 75% of the excess weight.
Wow.
Okay. Important thing about these 2 procedures is that both of them create metabolic changes and hormonal changes that give you the weight loss as well as the cure of disease.
And you said something about hormonal changes. What would that look like?
So hormones are substances in our body that control pretty much everything. Your blood pressure, your blood sugars, cholesterol, and so on. When I'm talking about hormonal changes, I'm talking about the changes that promote cure of the diseases that we mentioned, like diabetes and so on. The last procedure that I want to mention, something else that I want to mention is these 2 procedures are not guided to give you malnutrition. These 2 procedures are guided to create these changes. We have another procedure called the duodenal switch. That's how it's popularly known.
Okay.
A lot of people have not heard about it. It's a procedure that it's been done for a long time, but it kind of went down, the amount of procedures that we did, and now it's growing again. And this procedure is reserved for people that have tremendous amount of weight, 500 pounds, 600 pounds.
Yeah.
And this procedure is a combination of a sleeve and a bypass. It gives you all the changes that we talk about, but on top of that, it will carry more difficulty with nutrition, which in turn is going to turn into even more weight loss. And that's why it's also reserved for the people that have tremendous amount of excess weight. You know, 400, 500 pounds excess weight.
And all the procedures are available with Healthy MD.
We do all the procedures. We have all the support. We can teach you everything that you need about all of them.
And guide you every step of the way. Not perform a surgery and you get a bill and then you don't see them anymore and they don't care about what happens. That's not what happens at Live Healthy MD.
You will have to see us for life, because we care about not only about how you do with the procedure, but how your life changes afterwards.
Awesome.
And we have all the support. Pick up the phone, call us, and we can take it from there.
Yeah, and what we do, you know, people saying, you didn't give the number, you didn't give the number. We have on the screen where they can get the information, all the locations, Live Healthy MD, Augusta, Dublin, and soon to be in Macon. And I really want to let the viewing audience know why wellness is so important to me. My mother died from diabetes, and it's a degenerative disease. If you can do something, do it. I give a full endorsement to Dr. Francisco Jacome, Live Healthy MD. You're in good hands, not with Allstate, but with Live Healthy MD, Dr. Francisco Jacome. Thank you so much.
Thank you.
We're going to go to a break, and we'll be right back after the break.